So how often can a patient have the SphenoCath procedure?
So SphenoCath can be done as soon as once a week. However, in our practice, we typically do it once. We typically do the procedure once, take a look and see how well someone responds, and then we kind of adjust how often we do it based on their initial response. Some of our patients get a positive response in their headache, but it may only last 2 to 3 weeks. And in that case, we'll just repeat it, expecting a build-up response or a summation response over the course of time, where you can get 2 to 3 weeks with the first one, but the next one should last 6 weeks or longer, and hopefully get them to a point where it's one treatment every 3 months or longer in between.
So could SphenoCath be used as a preventative therapy? If so, how often should a patient have the SphenoCath?
Yeah, great question. So you can use it for acute treatment, and we certainly do that for people who are stuck with status migrainosis or people who've got other persistent headaches that are acutely activated and are giving them a lot of distress. As an example, it can be used in the emergency department setting. It can be used in urgent care settings in the office to stop someone with a bad headache. But in our practice, where we have a chronic headache clinic, we use it far more as a prevention therapy. And we typically do it once every couple months to maintain someone's headache improvement.
Is the SphenoCath procedure hard to learn?
Well, I kind of joke and say it's so easy, even neurologists can do it. Once you've got some practice with this, it usually takes about 15 to 20 seconds to do the procedure. The patient has to lay flat for 5 minutes afterwards to allow that medication to soak in. But once you are able to do it and the patient's in the laying down position, they become very, very fast procedures to do. Once you've done a small number of these, you get used to how the procedure feels. And it's the kind of thing that once you know how the catheter is going to feel in the nostril, you can do these things within 15, 20 seconds. The other thing about this is it's really hard to mess this up. So that if you do the procedure and the medicine doesn't go to the right spot, you've just missed your target, but there's no ill effect to that. It's just the patient may not get a response from it. And the catheter itself is very well tolerated when it's placed in the nostril. Most patients say it feels like there's pressure in the nose. There may be a pinch at the very end when the SphenoCath tip is being extended to the right position. But outside of that, most patients find this very well tolerated. Certainly if you're going to use lidocaine, there's going to be a weird taste in the back of the throat, usually a bitter sensation, but that is usually the worst of it. And what we'll see when you do the procedure, sometimes the eyeball will water, sometimes the cheek will flush or feel more warm afterwards, and those are all markers that you've affected the sphenopalatine pathway and the autonomic effects on the cheek and the face.
What percent of lidocaine do you most commonly use in the SphenoCath procedure? And are there medications other than lidocaine that can be used as well?
Yeah, certainly. So the most common used medicine is 2% lidocaine without epinephrine, but it's up to the provider to decide what they want to use. Some practices will use 4% lidocaine, and some practices have elected to use other medicines outside of lidocaine. But I would say at least 95% of the cases are lidocaine, and almost always it's 2% without epinephrine.
So no two patients have the same anatomy. When you evaluate a nasal passage before SphenoCath, do you do that first of all? And then second of all, what if there's a nasal polyp or a septal deviation?
So when I assess someone for a SphenoCath procedure, I do visually inspect the nostril, just briefly. No need to do an in-depth survey of their nose, but I just look into their nostril. Almost always someone's going to have some septal deviation, which is not usually an issue for the catheter. The catheter is designed just to go above the middle turbinate and then hook over the head of the middle turbinate to allow medicine to be taken by gravity towards the sphenopalatine foramen. I know that's a mouthful, but the neat thing about this is the catheter has to go above the turbinate and hook over it in order to get the effect, which means if there's a septal deviation or a polyp, you can easily direct the catheter past those without any issues for the patient. It just takes a bit of experience in doing that. Even in my most complicated folks, you almost always can put the catheter in relatively easily. And the only chance we can consider an obstruction not allowing the lidocaine or other treatment medicine to get to the sphenopalatine foramen region is if there's a mucus buildup around that area. And that's really quite rare. So by and large, even with septal deviations, even with polyps, we're almost always able to place the catheter. I've done thousands of these in my career, and I've only had 2 patients in my practice where I just couldn't put the catheter in, and then we just elected to do those under the fluoroscope as opposed to do them right at the bedside.
So if the first SphenoCath procedure does not provide benefit, is it reasonable to try a second time?
So I typically expect a good result with the first time we do it. It's important to know that the SphenoCath doesn't work for everyone. So there are going to be certainly patients who just don't respond well to the SphenoCath, but for those who do, it can be life-changing. So we typically do it once and see what the response is. If there's a partial response, even if someone says my headache was improved just for a couple hours or just for a day, I would certainly consider repeating it, expecting a summation response, a much bigger, better response the second time we do it. And that response can build up over time. However, if someone gets absolutely no response at all, in our practice, we typically reach for other treatment options in that patient.
What are the side effects of the SphenoCath? Do patients need to be observed after the procedure?
Yeah, so the question about side effects is an important one because that's one of the best things about the SphenoCath. Outside of a bitter taste and outside of a numb throat, because patients have to swallow the excess lidocaine once it's gone past the sphenopalatine foramen, there's almost no side effects. So very rarely you can get a acute worsening of headache, just like we see with any other treatment out there for the headache population. Very rarely someone can feel a bit unsteady afterwards. And then less than 1% of the time, people can get dizzy. And this dizziness may take a while to have its effect. Right now, we think that dizziness is where some of the treatment medicine, usually lidocaine, is going to go down the eustachian tube and affect the inner ear pathways. If that happens, the patient may feel dizzy for 20 minutes, 30 minutes, sometimes longer than that, but it always passes. And for that reason, we typically observe the patient for a couple minutes afterwards, and we commonly will advise them not to drive a car for an hour or 2 after the procedure.
Okay, the final question. Overall, how helpful has the SphenoCath been for patients within your clinic and within its needs, for the patient's needs?
And that's the best part about the SphenoCath. So we found over the course of time doing thousands of these procedures and a lot of patients who've got high intensity of headache, that this procedure first is very well tolerated, hardly painful at all, easy for clinicians to do. You get your results very quickly, so typically a change in headache pattern within a day or 2 of doing the procedure. Typically long-lasting results. On average, our patients who do well with the SphenoCath get between 2 to 3 months of relief each time we do it, some much longer than that. And overall, it's been a fabulous addition to our treatment for people with chronic headache. As an example, I've got a patient of ours who hadn't responded to anything, and we're talking more than 20 different approaches for headache prevention. And for her, we tried one SphenoCath procedure, and for the first time in years, she had 2 to 3 weeks of no headache at all. Now in her case, her headache started to gradually come back. We repeated the SphenoCath again, and then she got at least 3 months of relief, and has ever since we've been doing the SphenoCath procedures on her. She's just one example of many of people who've done fabulous with the SphenoCath procedure. And one of the best things about it is if someone doesn't respond, they've really just been exposed to a small amount of lidocaine, which is safe in pregnancy and safe in other treatment modalities in most cases, without any negative impact to them, and they haven't lost much time in their path to recover from chronic headache.
Thank you, Dr. Cooper.
Thank you for having me.